Hi, and welcome to Healthy Longevity. I'm Dr. Florence Comite, founder of Comite Center for Precision Medicine and Healthy Longevity in New York, Palo Alto, and Miami Beach. I'm really excited for today's podcast. We're going to focus on dental health and its critical impact on your whole system's well-being. Today's guest is actually one of the nation's most forward-thinking experts in this field, Dr. Alexander Volchonok, co-founder of TetraHealth Dentistry with offices in Manhattan and Greenwich, Connecticut. Get ready for an active and lively discussion about what your smile says about your overall health and longevity. Welcome, Dr. Alex Volchonok. It's a pleasure to have you here, and I'm excited about this conversation because there's so much I don't know about biologic dentistry, and I know you're the world's expert here. At least there are not very many of you, right?
Yeah. Well, first of all, thank you so much for having me here. I think this is a wonderful opportunity where we can bring together some of the advances in dentistry and put it forward with what's going on with medicine. So thank you very much.
Oh, good. Well, how much do you want to tell us a little bit? It's quite a mouthful. Your training alone is like 3 pages or 4 pages. So you've studied a lot and around the world.
Yeah.
Do you want to tell us a little bit about what made you choose that journey?
I grew up in a medical family and always had that itch, that drive to go into medicine. And when I was in college and I was exploring different fields, one of the things that really drew me was periodontics. And so periodontics is a dental field, but it sits right at the crux between dentistry and medicine. And it does so in kind of interesting way because a lot of the diseases that affect the mouth, especially on the periodontal side, have systemic manifestations as well. And so I kind of felt that this was a really interesting blend and a really interesting field to kind of go into that can combine that passion plus my interest to work with my hands and my interest to do surgery. So I decided to go down the dental path. And I went to the University of Pennsylvania, which is one of the premier dental schools, but it has a wonderful foundation in periodontics and the incorporation of those sciences into the way that we treat patients. And one of the most important things I always learned about that was that it's not about the treatment, it's about getting the right diagnosis for your patient, right? There's a lot of proper ways to treat a situation, but you have to first understand what's going on with the person. And a lot of our classes were taught with medical faculty and intertwined in that way where we started to understand that the body is so integral and so interconnected with what's going on, with the mouth. And so as I kind of proceeded along my journey, I went to Columbia for periodontics. And a lot of my faculty there were international. And so I spent time in Europe, in Switzerland, in Sweden, in Spain, in London, and appreciating the fact that there's just such a diversity of information. And depending where you learn and where you go, you'll get a lot of these different insights. After graduating, I did additional fellowships and certifications, including one with the International Academy of Oral Medicine and Toxicology, the International Academy of Biologic Medicine and Dentistry. And most recently, actually, and interestingly, there's a joint program with Goethe University and Tufts University in biologic dental surgery. And that is one of the things I'm most excited about because this is the first time that in the US we have an accredited program that's recognizing biologic dentistry.
I have to say, I think you were ahead of the stream because the biggest area of medicine that everybody's diving into is the microbiome, and the mouth is the entrance to the entire microbiome of the colon. The colon is the biggest organ in the body, and the exchanges that happen starting right at the mouth and at the periodontal area is where inflammation and other diseases can be picked up.
Yeah. I think that you nailed it on the head when you kind of talked about this entry point. And this is something that I speak to my patients about all the time. We focus on all these systemic symptoms, but we wonder, where does all this stuff start from? Where does it manifest? And when we think about bacterial, conditions or inflammatory conditions, right? There's a few entry points, right? We talk about the importance of nutrition and the gut and the microbiome of the gut, right? But the start of the GI tract is the mouth.
Exactly.
The start of digestion happens in the mouth. And oftentimes that aspect is overlooked. And it's overlooked in many different ways, but one of the most important is the periodontal health. And so the periodontium is the supporting structures. It's that frontline defense that our gums provide to the rest of our body. Not unlike our skin. If we have cuts all over our skin, and then we're out there gardening, and we're in an environment where there's bacteria and dirt and pathogens, well, we're gonna get sick. And the same thing happens with our mouth. If we have gum disease, periodontal disease, and we have these open wounds in our mouth and our gums are bleeding and bacteria is getting in, well, this is going to stress our immune system, right? This is going to stress our endocrine system. This is going to stress our gut. And what periodontal disease is really a dysbiosis, right? It's a dysregulation of the microbiome of the mouth, and it has so many downstream effects, whether it's the gut, the brain, the endocrine system, the hormonal system, everything is intertwined.
Or the brain in the gut, which happens too.
Exactly.
There's so much in terms of vascular infusion. We diagnose gum disease and abscesses when we see abnormalities in the studies we get, and we can tell a patient something's going on. You may not be feeling it, but you need to check out your mouth. So we're in complete agreement with that. So how would you describe, is that the description you typically give for what biologic dentistry is versus what we think of as conventional dentistry?
Yeah, it's a great question. The most important thing to understand is that biologic dentistry is kind of an overarching philosophy on top of what we learn in traditional dentistry. It's not just about treating the teeth or preserving the tooth. It's really about understanding how the mouth plays this important role with regulating the rest of the body. And it's about creating that connection, right? You can't have a healthy body without a healthy mouth. And truly vice versa, right? If the body is diseased, we're gonna see those manifestations in the mouth. And that's one of the things we're trained to look for, right? We can detect inflammatory conditions, we can detect GI conditions, cancer conditions. These things do come up and we can see manifestations in the mouth. It's like a window to the rest of the body. The other important pillar and the other important tenet of biologic dentistry is that it's not about focusing on symptoms. It's about getting to the root causes of problems, all right? And understanding that those root causes of problems may not just exist in the mouth alone. These problems may exist within the body, all right? And understanding that if something's going on, let's say a certain tooth is giving pain or certain issues, we have to kind of look beyond that and understand what else is going on here. And because of that, you work not only with other dentists, but you also work with other functional medicine doctors, integrative doctors, health and wellness experts, to really get a full picture, get a full understanding of the patient before you. And that's really how you can really unlock proper health and medicine for patients today.
Great. Well, we definitely are on the same path, because here when we practice precision medicine, for healthy longevity, we look at the whole human being as a system. It's not separate body parts with your mouth here, your heart here, your brain there. They all communicate. And in doing so, we connect the dots and we integrate that kind of understanding. And then we want to interpret it to get to our insights, to know what is going on in that human being and how we can intervene with personal or targeted interventions so that we can turn around the clock, but most important, stop disease and stop biological aging, which is at the cellular level. So the mouth definitely has to be integral to that. I would love to understand, seeing a new patient, how does that work? What's the first step?
Yeah, so one of the biggest things that we focused on was trying to create a process for how we can get all this data, right? We have all these great modalities today that we can get diagnostic information at a much, much higher level than what you can get with conventional dentistry or conventional medicine. And so one of the things that we've developed in our practice is called the ROSA screening. And so the ROSA screening is an acronym for Radiographic Oral, Salivary, and Airway Assessment. And this encompasses the four important pillars that we find that the mouth can play with the rest of the body. Patients that will come in will get a 3D CBCT scan, which is essentially like a high-definition X-ray to understand what's going on below the surface of the gum and the bone. This can uncover hidden infections, like infected teeth that may be completely asymptomatic and may not feel anything because the nerve is dead. It can identify infections in the jaw, such as cavitations. It can uncover other pathologies and other issues so that we can best treat, the patient as a whole. We'll also do an oral assessment, an oral cancer screening, evaluating the gum, the teeth, looking closely for periodontal disease, dental decay, xerostomia or dry mouth. We'll also do salivary testing. This is something that's really, really interesting to now incorporate. Today, we have modalities where we can test saliva for the DNA of microbes, as well as inflammatory markers. And we can get a much more complete picture of that patient before us from the standpoint of what is their microbial health looking like, what's their oral microbiome like, as well as what's their predisposition to inflammatory disease. So two people can walk into the room and they can look completely identical. They can have the same diets, the same activities, be the same age, but yet one is succumbing to gum disease or rampant decay or some dental problem, and another one isn't. And this information is very, very telling because it really gives an information that you can't receive otherwise. And the last part is airway assessment. And this is, today people talk about sleep and airway health a lot. And one of the most important things that we can understand is that the structures of the airway start with the mouth and the nose. And if there is malocclusion, meaning constriction of the airway due to teeth, enlarged tongues, overweight patients, these are all factors that we can focus on to get an understanding of how to help. And so when we think about how do we biologically treat our patient, right? How do we look beyond just the tooth or just the gum? This ROSA screening is kind of our starting point with a patient that gives us so much information beyond what a typical dental exam would do.
Completely understand. I'm curious, how do you, when you talk about looking for cancer specifically, you're talking about cancer of the mouth and cancer in the area that affects what you study?
Yes.
Or are you talking about you can detect changes in the mouth and you can pick up details that might point to cancer elsewhere in the body or disease elsewhere in the body?
Yeah, so actually kind of both ways, and you can look at it in two ways. So obviously we will be screening for any types of oral cancers, whether that's on the tongue, on the floor of the mouth, the palate. The CT scan can help us identify if there's anything going on within the jawbones, which is really important. So those will be kind of our standard dental examinations. But when we combine patients' health history, family history, and their genetic markers for inflammation, sometimes we can start to see, oh wow, there's more to it here. And we start to kind of dive in a little bit more, and whether that's asking patients certain questions about predisposition to things, or encouraging them to go on for other testing, whether it's genetic testing or other screenings, to take a look at it. This is a really important aspect. I actually recently had a patient in my practice that came in earlier this week who unfortunately has a very significant cancer history, very young patient. And one of the concerns was that she might be developing something in her mouth. And so we were screening that and we were taking a look at seeing what was going on. And what I was realizing is that, she was getting care in silos. Even though she was being treated at Sloan Kettering, which is a great institution, there's a lot of silos of care, and there's not this communication between the oral health field and her medical team and her integrative ENT doctor, who's now in a separate silo. Like, we're all kind of looking at her independently and understanding that you really got to put this together and share that information. So I encourage her to go get some additional imaging that I myself want to look at as well, to rule out anything from the head and neck situation, but bringing that all together is going to be much more, important to help understand what's going on with her.
Well, wow, that was a great example. And I have to say there, you hit three major points which completely align with the way I think of how we should take care of people. One is that everybody is unique. We think of it as an N of one. So you're speaking about two identical people. I happen to be an identical twin.
Right.
So I knew from the get-go that we were not even completely identical, because once you separate, the genes can do its own thing. You can implant in a different environment in utero, and then subsequently you're not occupying the same space. Even Siamese twins are different, and they're still attached. you're different, I'm different. If you just divide your face in half, your right
Yes.
doesn't match your left, right? So that's number one. The silos of care is why I do what I do as well,
Yeah.
because nobody can talk to each other. Like I still remember the very first patient I saw at Women's Health at Yale in 1992 had 5 different doctors telling her 5 different ways to manage hormones, and nobody agreed with anybody else. So that's the other issue. And then systematically looking at what I think of, you referred to health history, family, genetics. I look at the health story. It's not just about a chief complaint. I imagine in your world it might be pain, it might be bleeding, it might be inflammation. To me, that would be a chief complaint. But what we've moved on to many, many moons ago is looking at the whole human being. So we're in complete agreement there. What I'd love to turn to now, though, is aging and dental health. How would you advise somebody? What is critical about how we might look at the mouth differently through the lens of your aging? Do hormones have an effect? Is there a relationship between the teeth, the mouth, and the heart? I certainly have heard, and I've treated patients for issues regarding osteoporosis and bone loss and teeth loss due to low calcium, low D, inability to grow bone, and which affect the teeth with aging. Do you want to speak a few words about that?
Very loaded question. I'll try to unpack
Lots of
it.
moving parts.
But one of my favorite questions that you kind of asked, and I'll kind of rephrase in a little bit of a way that sometimes I hear it even from patients or people ask me. They kind of say, is it normal to have gum recession as you get older? Is it normal to lose teeth as you get older? And the reality is, if you look at the research and you kind of understand that periodontal health and dental health as a whole is something you can maintain your entire life, all right? And so this is not something that is a prerequisite, as you get older, this is supposed to happen, right? Yes, you have more exposures, things can happen, right? Inadvertent things can happen. You can bite down on an olive pit and break a tooth, that can happen. But to think that you just would naturally succumb to disease or that things should fail is not the case. And I think changing the mindset for patients to understand that is really one of the important steps of getting healthier. Because if you start from the idea that you're going to get sick, all right, or if we say another way, let's take a medical example, you're going to get cancer. Well, then you kind of change the way you approach the process getting there. All right, you don't focus on things from a preventative perspective. You're not proactive in the treatments that you're going to do or the lifestyle that you choose. But that's one thing I want patients to really know is that you can have a healthy mouth, you can have healthy gums your whole life, and that's
so
really important.
That's point 4 and 5. That first of all, you don't have to think your genetics and your lifestyle dictate your destiny. You can change expression of disease and expression of genes to be able to keep your health. We have to explain that. We have to educate and demystify the notion that, well, my mother had diabetes, or my father, his teeth are all gone and his whole jaw sunk in. Won't that happen to me? And just take it for granted, but rather re-educate people to understand, no. By investing proactive prevention, you get to keep your mouth and your beautiful smile till the very last minute, when in my world you go to sleep and just don't wake up the next day. But otherwise, you're fully active, running around. You can do whatever you want, from bungee jumping to skiing till 120 or later.
Yes. And I kind of say that because, as I look at some of my older patients, one of the most important things that I kind of start to ask them about quality of life questions is, do you feel comfortable enough or confident enough with your teeth to enjoy a meal with your family? All right? Do you feel embarrassed to go out to eat, or are you comfortable to go out with friends? And if you think about it, in later decades of life, that is one of the things that people lose. All right, they lose that ability to maybe chew well, or are concerned about what they can order, or they'll kind of choose to be more reclusive as a result of this. And this is where oral health is so important, because if we can help you preserve your teeth, if we can help you preserve a healthy mouth, this affects lifestyle factors. This affects quality of life. This affects longevity, right? There's been plenty of studies that have shown people that are happier, that are surrounded by friends in later decades of life, live longer, right? And your mouth and your smile, your ability to communicate, your ability to eat are all central to making that happen.
Actually, a study out of Penn showed that people who were not well but went home to either an unconditional love of a pet or a significant other or friends and family that surround them live longer. Same thing with when you do get sick. So that is definitely true. And from my lens, teeth and oral health is very important. But think about getting a stroke or a heart attack and being unable to function because you're paralyzed and you sit on your porch. Is that the kind of life you want to live? It's the same thing as enjoying life to the fullest. Well, let's turn a little bit, it's related to any kind of experience in biological dentistry in hormones or the relationship to hormones given their role, for example, in bone and I imagine enamel, as well as, heart health and oral health. Is there anything specific or cases that come to mind that you might want to share?
Exactly. I mean, hormones are something that are very, very important to understand because to kind of give an example, at least how I think about it, I live in New York City. We commute on the streets here. There's traffic everywhere. And I feel like our hormones, they're like the traffic lights, that kind of keep the order of how this whole system works, right? This whole grid, our whole body is being regulated by these signals that are constantly communicating with each other, and if you're commuting through, you'll see the lights will all change in sequence, right? In a very specific, very orchestrated way to keep things moving, right? Just like we need the body to keep moving in a certain way. But if all of a sudden someone or something is starting to play with all the buttons and when a light's supposed to go green, it goes red, or it's green and the walk sign goes on, all of a sudden bad things happen, right? And this dysregulation, hormonal imbalances, hormonal insufficiencies play an important role throughout the whole body. One important thing that we see with the mouth is the effect that it will have on bone health, right? Because hormones such as estrogen is very important for the stabilization and preservation of bone density, right? And same thing with testosterone as well. So patients who are losing these, especially in later decades in life or going through adrenopause or menopause, these will affect that bone density process that we see in the jaw as well. Now, if you couple that also with periodontal inflammation, meaning bacteria that's out of control in a dysbiotic environment that's creating inflammation, you're now going to accelerate that bone loss, all right? And the end result of that is not only oral disease like loss of teeth or inflammation, gum disease, but also systemic concerns. You mentioned a really important one, cardiovascular disease, right? If bacteria is able to invade through the gum line, and that's exactly what it does. If your gum is not a solid frontline defense, that bacteria is invasive. It's going to get in, it's going to get into the bloodstream, and it's going to create inflammation in other parts of the body. Right? And even, we now know for about 30 years the presence of atherosclerotic plaques in the heart and the endothelial cells, the blood vessels that line the heart, have bacteria, oral bacteria in them. How do they get there? Through the gums, right? And if you have leaky gums, right, just like a leaky gut, if you have leaky gums, this bacteria is going to create havoc throughout the body, upregulating C-reactive protein levels, inflammatory cytokines like interleukin-1, interleukin-6, tumor necrosis factors, increasing people's risk for cancers, and even amazingly, even crossing through the blood-brain barrier, right? And we're seeing associations with Alzheimer's disease. So, again, our body is not siloed. It's not compartmentalized like we like to think of it, right? I'm a dentist. My disease is only in the mouth. It's only in the head and neck. But the reality is what I deal with affects the rest of the body, just like what you do with hormones and the endocrine system affects the entire body. So we need to have this well regulated. And so one of the things I always think of is patients who are going through certain phases of life where hormones can change, right? Like, for example, like pregnancy or menopause or someone who's considering hormone replacement therapy. These are important times to consider getting an oral screening, an oral exam, and kind of understand what's going on in the mouth as well, because it's a two-way street, right? If we have inflammation in the mouth, it's also going to dysregulate that endocrine system, creating that chaos on the roads and creating all those problems that we really need to avoid if we want to keep the body healthy.
Now, again, I'll really make this analogy to what happens in medicine, but I'm sure you've heard of subendocardial endocarditis, where you get an infection in your mouth or you have some tooth work and a bug gets in. A lot of dentists, I don't think it's as common as it used to be, but a lot of doctors and dentists work together to suppress that in people who go through, sort of prolonged treatments of the mouth, because the bugs can get in, invade the valve of the heart, and you're stuck on antibiotics. If you don't die, you're stuck on antibiotics for at least 6 weeks to clear up that infection in the heart. So there's definitely a direct connection. A lot of folks in previously, I'm not sure it's state of the art now, but mitral valve prolapse, a lot of patients would pre-treat it with antibiotics in order to prevent that from happening. I think that is now 50-50, not always happening, but it's a kind of interesting concept, and it just spells out that real connection. And it's more than hormones. I think dysregulation, we believe in hormonal optimization, but it's the entire metabolism, what happens to sugar, what happens to insulin, and all of that is affected by your mouth as well, and what you put in your mouth. So
Exactly, yeah.
I have so many questions. I don't know where to go next. I think we want to make it clear, though, while women are also affected, men have hormones too. And so there's andropause in men, periandropause, and menopause and perimenopause in women. And both create change in the body. And I'm assuming at the very least, what you advocate is a yearly or annual, at least, assessment of your oral health. Is that part of parcel of how you practice?
Yeah, I think at the very least, if you have the ability and you have an opportunity to get a screening as similar as possible to the ROSA screenings we talked about, nothing could be more complete in understanding your oral health picture today than that. But at the very least, I think it is important to see your dentist, to have an evaluation, and understand that there are testing options out there. There are treatment options and scanning options for diagnostics that are out there that are very, very advanced to help detect and determine these things and catch disease proactively.
All right, so you've pointed out 2 additional areas that are exactly what we think about, that people feel like disease is inevitable, that if something runs in your family, you're bound to get it. So teaching and re-educating people that it isn't so, that there are ways to turn switches on and off in the body is something we do routinely as well. And that's the demystification and the education. And the final one is helping people understand that there are ways to be proactive, that they can put work into place on themselves, and it's a huge return on that because they'll own their own health destiny, and they'll be able to stay great from the mouth on in for the rest of their life. And I think you articulated that really well.
Yeah, thank you.
All right. Exactly now I'll end with some questions and curiosity additional that I have, because I've just thought of more and more. Inflammation in the gums and bleeding, how do we avoid it? What are the tips you can bring to mind? Is there one major thing that people can do if they worry? Because it seems to be fairly common, and yet it sounds like it shouldn't be. What would you do? What would be your recommendation on a personal level that you do to care for yourself?
Exactly, yeah, great question. One of the things I think that's really important is to think about what tools we can use to take care of our mouth at the most optimal level. So think about it. When you go to a dentist, right, or you'll see your hygienist, we'll use specialized tools that help us clean the teeth better. So there's a home version of these tools. One product that I'm very, very fond of is using an electric toothbrush, right? And using a professional electric toothbrush. I'm not talking about the one that's like at CVS for like $12. I'm talking about making an investment in a higher end toothbrush that is able to really clean not only the tooth surface, but also below the gum line. There's a lot of technology that's been built into these that can also help track to make sure that you've cleaned all the areas of your mouth. There's also pressure sensors to make sure that you're not brushing too aggressively and causing other issues like gum recession. So I always try to advocate, and one of my favorite holiday gifts to give out to people is electric toothbrushes. The second thing,
Is there any one particular electric toothbrush that you
yeah,
think is, and I don't know if you have a vested interest in it, so you
no,
can
no,
announce
yes, I have no vested interest in this, but I will say that I'm a personal fan of the Oral-B IO, like the letters, toothbrush. It has a round brush head, which is exactly like the dental tools we use when we clean the teeth, and it's able to gently clean below the gum line.
Is that the one where you can vary pressure and it has an app where you can see if you've cleaned well?
Exactly, yes.
So
Yeah.
my sister told me about it because she ended up getting braces later in life because we have different teeth, believe it or not. We were
Yeah.
born a little different where two of my teeth were small, but they didn't grow in her at all. So she decided finally she's going to do something about her smile. And that toothbrush, I'm scared of it. Like I use it sometimes, but it's like I have to fight with myself because it really keeps track of what you're doing and not doing.
Exactly. Yeah. Yeah.
Right.
And if you haven't grown up with it, so I have
No,
two
I
young
have
daughters.
not
So
grown up with it.
my now almost 8-year-old daughter, I've had her from day one, always using an electric toothbrush. So she's very used to using it, like a pediatric version of it. But this has become a secondhand, nature for her. Most of us grew up with manual toothbrushing, right? And some of us grew up thinking the harder you scrub, the better the clean will be, right? And the reality is none of that is true. Using the right pressure, using the right type of brush is really the key. And so that's one of my tips I like to give away. Another one is using a water pick. And a water pick is interesting because I almost kind of call it like an oldie but goodie because depending on the
I
generation
remember my
of
mother and father using water.
Yes, exactly. Depending on the generation of patients you'll talk to, some of them have used it and some have never heard about it. But there is no hygiene tool more effective at cleaning below the gum line than a water pick. Floss doesn't do it. Proxy brushes don't do it. Toothpicks don't do it. Water pick is the number one recommendation I make to any patient who has bleeding gums, gum disease, or anything like that. And I find that as long as you stick with it, there's a little bit of a learning curve, but if you stick with it, the results are really quite fast in terms of getting the bleeding to stop. And also the feel and the clean that you'll have in your mouth is so much better. And the experiment I always have patients do if they've never used one before is I tell them, just go brush your teeth like you normally do. And then just try the water pick and tell me if anything else comes out into the sink.
Let me ask you a few things. How much time a day do you have to spend brushing your teeth with an electric toothbrush that really works because it's the rounded head and it times it and it makes sure you get every surface? And then you do the water pick. Because I remember my mother taking a lot of time to do this. So how much time do you invest every day? Is it an hour, half an hour, 15 minutes?
Yeah, 23.5 hours, right? Take care of your teeth. Yeah, it is a routine. It is a routine. And anytime we have patients who are susceptible to this, I will tell them that, look, we're trying to reverse a pretty substantial oral and systemic disease process with periodontal disease. So we got to put in the time to do this. But, I think when you get good at it, when you kind of get comfortable with how the tools work, it will take you anywhere between 1 to 2 minutes to water pick your whole mouth. And actually, I tell patients to do that first, right? If it's something you haven't done, it's always easier to put a new habit first and then couple it to something you're going to do afterwards. And then brush for 2 minutes after. And so that's really kind of my optimal
Brush
regimen.
for 2 minutes and at least a minute or two the water pick, your
Exactly.
whole mouth? You
Yeah.
can get your whole mouth?
You can,
So
yes.
you're talking about a process that should take less than 5 minutes.
Exactly.
All
yeah.
right, because when you time it, it seems like forever. Well, I think you've relayed a lot of my fears about a lot of people are afraid to go to the dentist, more than the doctor, actually. But you've relayed a lot of those fears. And I guess my last question about dentistry, before I get to one that we like to have fun with, is when you get your teeth cleaned, a lot of times they're scraping things off your teeth. What are they scraping off your teeth that we can't get off with a water pick and a brush, perhaps, or maybe we can, and that's what the water pick is good for?
Yeah, so typically when you're going to a hygiene visit, if there is buildup of bacteria and biofilm that becomes a more solid adherence, we call that calculus, or tartar is another name for it. It is really tenacious. You can't brush it away. You can't water pick it away. Right. The only thing that can be done at that point is that it has to be kind of scraped off. And think of it a little bit like, if you go to the beach or you go to the pier and you see those barnacles coated onto that, it is just like that, just like that.
All right, now you've scared me to death. I'm going to go out and get the water pick immediately.
Yeah, but if you clean it every day, you won't.
Yes, now I have to find 3 minutes a day to do that. That's the hardest part. So if you're going to do anything, and you may have already answered the question with the water pick, but maybe you'll have something to add, and you're sitting next to someone on a flight, or you meet someone at a party, and they oh, you're this great dentist, one of a kind in the country, maybe even the world. What is the one thing beyond flossing and brushing, and maybe it has to do with the foods we eat or what we drink? What would you tell somebody to do of practical nature?
I would kind of answer in two parts. One thing that I'll say that I think is really important, and one of the biggest messages that I want to convey to people, is the importance of getting a screening of your oral health. All right. We understand this in other fields, like there's screening colonoscopies for GI issues, and that's become more mainstream and more understood. Echocardiograms for the heart to understand what's going on. But that does not exist in the dental care world, right? And one of the things, if I'm sitting on a plane next to someone, if I could give them one piece of really important dental advice, it is the importance of getting a really comprehensive screening and evaluation, and just being aware that we have such great diagnostic technology out there, because so many diseases are missed, so many manifestations of systemic diseases are missed, sometimes for years at a time, when the signs have been there, right? And so that, I think, is one of the most important things I'd like to convey. And I think that at certain decades of life, it becomes very important to look at that, right? There's a lot of changes that happen between our second and third decade, where disease processes start, right? The microbiome starts to make certain shifts. And so I do recommend that you do get this screening, right? You get something that can take a look at your jawbone in 3D, do some salivary testing to understand your microbiome, your genetic markers for disease, because these are important things to have.
And I guess I grew up in a world where we did have routine visits and not screened to the extent you are saying, so I'm curious about following up on that.
Yeah.
But thank you. This was amazing. I'd love you to tell our listeners how to find you, and where, if you're on social media or website, I'm sure they'll want to know.
Of course. Yeah, I'd be happy to connect with anyone. You can find us on social media at MyTetraHealth, and our website is www.mytetrahealth.com.
Excellent.
Thank you so much.
Thank you so much. It was fun.
Yeah, thank you.